Hello and welcome to WP. Well, COVID-19 has impacted the lives of people in WA and around the country, with many states going into a snap lockdown this past week. Lockdowns and restrictions in the past year have impacted lives, but have also wreaked havoc with mental health and well-being, as lives haven't been able to continue as normal. We talked to psychiatrist Lin Tan about the impact COVID-19 lockdowns are having to mental health and how to combat it. Lin Tan, thanks very much for joining us today. So this is a very difficult time for people during this lockdown. It's safe to say it's stressful for people, isn't it?
Yes, it can be very stressful though. So to go through this particular stressful time, I do have some strategies that I like to share with everyone. Just try to keep the routine as much as you can, because if we can minimize the disruptions to our daily routines, that is going to reduce sense of anxiety as well. So for example, if you normally go to gym at 5 o'clock, try to do it at home as well, and be creative. You see, you don't need to physically go to somewhere to do these normal activities.
So routines are important. Is it a way to minimise the impact?
Exactly. So that's what we normally advise our clients as well. So definitely you want to try and minimize the disruption. So like I said, try to maintain the routines. That's definitely one way to go. And then secondly as well, just as if you're feeling a bit stressed and anxious as well, do apply self-care. Try all sort of techniques that you normally do to self-soothe and to help yourself calm down. You see, this could be just going out for a walk, obviously with your mask on, and also just doing things that you love, enjoy doing.
What's your advice to young people who might feel a little bit overwhelmed?
Yeah. See if you could, on top of things that it relaxes you or excites you, try to break things down into chunkable sizes. So if things, get really overwhelmed though, try to see if you could break it down into smaller things, come up with to-do lists or strategies that helps you to manage time effectively.
The numbers of calls to help organisations and services have gone up, so this is a good thing to have?
I think so. Yep, I think so. Even though it looks concerning that the number have gone up, however though, that also means that people are actually accessing and also utilising those services. And it might be, for those who like to get some advice and get some help, and also for those, who like to find out how they can support other people effectively. So I reckon that's a really good sign.
And finally, this is not the first lockdown and it won't be the last. How do people manage these stresses in the long run?
Sure. What I would say though, do not lose the perspective. See this as just a temporary situation that we are in. With the rollout of vaccines and things like that, we are going to get through this together. So do not lose that picture.
And now, here's this week's COVID-19 commentary with AMAWA spokesperson Dr. Andrew Miller.
Hi, very interesting around the country at the moment with lots of different COVID outbreaks in the community with the Delta variant, and we're seeing how much more difficult it is to keep this under control. Remembering that around 8 out of 10 people don't spread the disease at all, but those who do, that remaining 2 out of 10 tend to spread it to a few others. And so it's been good to get the Perth situation under control, get that lockdown hopefully finishing up and wrapping that up, but we can't afford to be too complacent. And interesting to contrast with New South Wales, where they have a more open approach and a bit later to lockdown there, and you can see how much more work it takes, how many more exposure sites and so on to close it all down. So, they might argue that it's less disruptive, what they've done in New South Wales, but I think it's going to last for longer in terms of trying to get it back under control. And of course in Queensland, 5 different sources of the virus, it seems, in the community there. And you can see how easily this whole thing could get away from us. Our contact tracers here have done a great job, and but without the lockdown, they were at the risk of being pretty exhausted by it with only a few cases really in the community. So QR codes, very helpful. And the future will be trying to keep this to zero spread while we get our vaccination rate up something above 80% for everyone over the age of 12, which is what we need to get to herd immunity and protect those who cannot be vaccinated or who won't be vaccinated. So that then brings us to the discussion of vaccination. Obviously still going fairly slowly, around maybe 5 or 6% have had 2 doses in Western Australia so far. So a long way to go there, mainly depending on that supply of Pfizer coming in later on, because they've already said they're going to stop using AstraZeneca most likely after October. And whilst it's been a useful vaccine to some degree, we can understand why that's the case, given that there's pretty poor uptake in vulnerable groups now, particularly those over the age of 60 who it's indicated for. Many people now saying, well, I'd rather take my chances between now and when I'm going to be able to get a Pfizer dose. So it will be good to see a range of other vaccines coming into the community, hopefully very soon. We're expecting some Pfizer, obviously, Moderna, Novavax, and getting some onshore capability to manufacture. All of this happening a bit slow, along with proper quarantine facilities also in the offing, but still happening a bit slowly. In relation to the federal government's plan for opening up again and not needing to isolate and lock down after we get high levels of vaccination, well, that's all fine, but I think we need to see some numbers around what they mean by that, and we can't get too confident at this stage. We still have many months to go, during which we're going to need to carefully quarantine and lock down to keep this horrible disease away. And we also haven't spoken much about children yet. And there's a big argument going on about the UK where they're looking to open up without having vaccinated children. And there are many paediatricians who feel that they are the ones with the most to lose in terms of years of life to long COVID and autoimmune disease. And that even if these things happen, along with childhood deaths in very small numbers, if you multiply that by your entire paediatric population, that is a huge price for any community to pay. So I'm certainly one of the ones who's loudly saying that we're not out of this until the kids are vaccinated, right down to as young as possible. And that's a conversation we need to have before we open everything up. Whilst trying to support those who are suffering economically, I think we can all see that the economy here has done a lot better than it has in places where they've been ravaged by this disease, and they have no other way out now other than to open up with the disease spreading through their childhood communities. Thanks for your time.
And that's WP for this week. We'll be back again next time, but for now, it's back to you.
Thank you, Nelson. And here's Leo with what's coming up on 6 News tonight.
Thanks, guys. Tonight on 6 News breaking news, 1 week into Sydney snap lockdown, the city and the state is on edge amid fears of more cases, while other cities across the country begin to enjoy new freedoms. Our reporter will have the latest on the ground from the CBD. Plus, confusion over AstraZeneca's jab continues, with some now hesitant to get vaccinated because of it, as doctors report a surge in people cancelling appointments for their second dose. A special report, which days after unveiling a full-phase plan to get Australia back to normal, the PM is now facing criticism amid questions about how realistic it is and when the goals will be achieved. And a major announcement about us. Don't want to miss it. You can see full details on those stories and plenty more by heading to our YouTube channel. Just search 6 News Australia to find us, and our website 6newsau.com. For now though, guys, it's back to you.
Thanks, Leo. And that's our weekly news and current affairs. We have the latest news on our website, wamnnews.com.au.
From Sarah and myself, we wish you good health, good night. See you next Sunday.
Thanks for watching.